One of the things my patients undergoing pelvic surgery are petrified of is having to go home with a Foley catheter. A Foley catheter is basically a drain that we insert into the patient's bladder during surgery to help them drain the bladder. We usually remove it right before patients are going home, and about 10% of patients may have difficulty emptying their bladder afterwards. Then we do recommend that they go home for a couple of days with the Foley catheter to let their bladder rest. Patients hate it. I get it. It's uncomfortable. Nobody wants to go home and walk around with a bag of urine, but understand that the reason we do this is to protect your bladder. If you cannot drain your bladder, the urine can collect and can stretch the bladder wall and can cause some serious damage. I have seen it where patients have gone home after surgery, not able to empty their bladder, and then ended up in the emergency room with their bladder stretched out and holding like 4 to 5 liters of urine. They're in excruciating pain, not to mention that there's going to be some serious permanent damage to their bladder wall and the nerves, and in worst case scenario, their bladder